Hi viewers, welcome back. In today's video, we are going to discuss about warm chain. Okay, so what does this warm chain mean and where does it come? Okay, so warm chain is nothing but it is the maintaining the chain of warmth when the baby is delivered, when the baby is there inside the labor room, when the baby is getting transported to the ward. So in case if it is to the ICU, so wherever it is, like till the baby is getting out of the institution, then till the baby is going home, okay, you have to maintain a warm cycle in the baby. Okay, so this term is called as the warm chain. So that is the maintenance of body temperature for the baby, which is the normal body temperature. So the normal body temperature of the baby is 36.5 degrees Celsius to 37.5 degrees Celsius. So this is the normal body temperature of a newborn baby. This temperature has to be maintained when the baby is delivered and until the baby is getting transferred to the home. So until the baby is getting discharged. So what is the benefit? Why are we doing this? What is the benefit for the baby? Okay, so once we see the normal temperature is 36.5 to 37.5, then what is hypothermia? Hypothermia, the term of hypo means less. So when the temperature is below 36.5 degrees Celsius, you term it as hypothermia. There the baby is feeling cold, the baby can go in for complication. Then comes hyperthermia. Hyperthermia is when the body's temperature, the baby's body temperature is more than 37.5 degrees Celsius. You term it as hyperthermia, where the baby is exhibiting the symptoms of hyperthermia. Baby is getting warm. So baby is having increased amount of heat. So these two terminologies you have to remember. So now we have 10 steps how we follow this warm chain inside the hospitals. Okay, so first one is the normal delivery room. So when you are going to deliver a mother, okay, so it is always you deliver mother. Nowadays it is all sophisticated environment. Even in small PHCs we see there is an AC fit. Okay, so now it is the AC for the mother as well as for the doctors, the students, everybody who is working inside the labor room, but it is not for the baby. So when you set temperature for the room, the temperature has to be for the fetus. It is for the temperature for the baby. So maybe like till birth you have a temperature. So when the baby is going to get delivered, the temperature must be around 25 degrees Celsius. That is like the room has to be little warm, because you can normally understand when how was the baby till now. The baby is going to be warm, comfortable, lying down inside the uterus. But now what is happening? You are having a different environment, that extrauterine life the baby is getting. So what is happening? The baby cannot balance the temperature externally. So the baby will go in for hypothermia. So now not only this factor, imagine till now the nourishment was from the mother, the warmth was from the mother. So the baby need not do any task to keep himself warm. But now during the extrauterine environment, what will happen? The first need, the first work of the baby is to maintain the body temperature. That is a big task for the baby. Okay, whatever you feed, when the body is metabolizing, the BMR, the maximum amount of BMR is going to go for the maintenance of the body temperature, and then only it goes to the other functionings. Okay, so the maintenance of body temperature is very, very important. So when you are having an environment where you are going to conduct delivery, then the baby is going to born, see to that it is going to be around 25 degrees Celsius, which is going to give a warm environment for the baby, so that the baby is feeling comfortable and baby is not going to go in for hypothermia. Then the next point is immediate drying. So you know, like as soon as the baby is born, what do? How do you receive the baby? Like with the towel only you receive. You don't receive the baby on hand. Okay, so it is like with the towel only you receive. So as soon as the baby is born, a warm towel will be there, and with the warm towel you receive the baby. So you receive the baby and immediately you will wipe the baby. So wiping in the sense, you are going to wipe the amniotic fluid, you are going to wipe the blood, and like whatever it is remaining on the baby, it is like you are going to wipe. So like this vernix you will not wipe, you are not supposed to wipe. Actually they are protective layers, they are going to give warmth for the baby. Okay, they are fat deposits which is going to give warmth for the baby, so you are not supposed to wipe that. Okay, so in the axilla, groin, they will have like little vernix that you are not going to remove. This body temperature, this external amniotic fluid, blood and everything, you are going to wipe with that warm towel. So as soon as the baby is born, immediate drying must be done so that the baby is kept warm. And then as soon as drying is over, the next step, immediately you have to put the baby in the warmer. So warmer will be near to the mother's side, and you will put the baby under warmer. So again the temperature is set in the warmer and the baby will be kept warm. Why? As soon as the delivery is over, we can't put the baby with the mother, no? So automatically she will have an episiotomy or otherwise an LSCS mother. So you must have suturing and all these things will be there. So you are like with the mother, with that pain, she cannot take care of the baby. So what you will do? So you have to put the baby under warmer. Okay, so that this warmth or the temperature chain will be maintained. And then comes skin to skin contact. So that is your KMC. KMC is nothing but your kangaroo mother care. So your like the temperature of the mother is going to provide adequate warmth for the baby. So when the once this suturing and the consciousness of the mother is regained like with an LSS mother, so what you have to do? Put the baby inside the dress of the mother. So whatever she is wearing, okay, the hospital uniform or otherwise nightie or whatever dress she is wearing, put the baby inside the mother and nicely cover it with the towel. So the warmth of the mother is more comfortable and soothing, so that it provides adequate warmth. Okay, so the baby is having a good contact. So now skin to skin contact, not only the mother has to provide, even the father or the grandmother. So anybody who is available in that baby, and particularly when the baby is having an hypothermia, in those conditions immediate skin care can be provided. Okay, so that is like KMC you have to follow. So kangaroo mother care is applicable in all the units, so encourage kangaroo mother care. And then breastfeeding. So I said like once the suturing is over, the immediate step is like you have to go in for breastfeeding. So already in many classes I have said you, breastfeeding has to be done within the first half an hour. So that is like within the first half an hour the baby is having an active phase, and in that active phase only you have to start feeding, so that the feeding is going to get continue. So within the first half an hour, as soon as the suturing is over, you have to put the baby under the breast of the mother, so she starts sucking. And then bathing and weighing is postponed. Why? Bathing, of course you know, you will be giving bath in warm water only. So you take the baby bath, and then by the temperature you take it out and you wipe, the baby will go in for hypothermia. For that reason alone, you are postponing the bath of the baby. So when do you give? The next day. Probably maybe the 0 day, not the 0 day, the next day, the first day the baby will get a warm bath. Okay, and there will be specialized nurses who are giving bath for the baby. They know how to maintain the temperature of the baby, so they will take care of that bathing purpose. And weighing, as soon as a baby is born, you have to weigh. That immediate weight you will be assessing, and then the frequent weight checking you are not supposed to do, because the weighing machine, so of course you will have a small warm clothing, and above that only you will keep the baby for weighing. But even then, removing the cloth and the bed of the baby and then weighing again and again is going to cause hypothermia for the baby. So try to avoid weighing every now and then. So postponing of bathing can also be done for the next day. Then comes the appropriate clothing and bedding. So what is this clothing clothing in the sense like with a baby, you would have seen when you enter into the postnatal ward, you see all newborns wearing one sweater, that is like a sweatshirt will be there, then mufflers will be there, then kutti gloves and socks and everything will be there. The baby will look so beautiful, and also it is your role, you have to mummify the baby. Okay, so you have to learn mummification, how you will do. Okay, so I will teach you how to mummify baby. Okay, so that mummification makes the baby more comfortable, and once you mummify and give the baby, it will sleep at least for 2 to 3 hours more comfortable, because the temperature of the baby is very soothing, so that it remembers it is sleeping inside the womb of the mother, and it will sleep for 2 to 3 hours very comfortably. Okay, so provide an adequate clothing and bedding in the sense like thick beds. Either you have to have a thick towel, so nowadays we don't do that, even like all the mothers, they will have a small baby bed available, so in that bed you can place the baby, then mother and the baby together. So once this procedure of suturing, and once the mother is regaining consciousness after delivery, so what must be done is like put the baby with the mother, so the baby sleeps with the mother. Okay, so the baby is close to the mother, with the warm, and that warmth and that cuddlingness provides adequate support, psychological support as well as physiological support to the baby. Okay, so always have the mother and baby together. Then warm transportation. Now till now the baby is inside the labor room. Now you have to transfer the baby to the ward. So when you are transferring the baby also, you have to be very careful. How do you transfer? Like you must have a bed, a trolley, like whatever you are having. So in that you must have adequate warm clothing, towels and everything placed. Put the baby, cover the baby nicely, expose only the face, and then take the baby from your labor unit to the ward. Okay, so after going there also, you have to follow the same room temperature, the clothing of the baby, the covering of the baby, everything has to be, you have to take care before you handle it to the ward. You have to take care of these things, and you have to come back. And then warm resuscitation. So in case if the baby is sick, if the baby is having meconium aspiration syndrome, or otherwise when the baby is an IUGR baby, small for gestation, all these type baby, in case if the baby is not crying, all these type of conditions, what you have to do, you have to resuscitate. So either you have to go in for like rubbing, from that time onwards, like you have a lot of steps for resuscitation. All these things will be followed with your CPR. Okay, so till your extreme of CPR also you have to consider. Okay, so till your CPR, see to that the temperature is maintained, then only the CPR is given. Okay, so cover the baby, with that only you have to provide CPR. See to that the temperature is maintained even though when you are resuscitating the baby. And then we have training and awareness creating. Training, of course, when there is a new staff entering into the labor room or in your pediatric ICU, you have to be very careful. You have to teach them how to maintain the temperature of the baby. And in case if the staffs are in the same wards, like you must have training or awareness programs every now and then, so that they become more knowledgeable every now and then, getting updated for the measures whatever is taken place in the hospital. And then like you are going to teach even the mother, even like some mothers, like they used to tell, my son, no, he doesn't like room temperature, he wants only AC, with that only he will sleep. When I cover him only, he will like stamp and it will push that sheet. It is not pushing the sheet, it is the reflex what the baby is exhibiting on the towel or the like sheet, whatever you are putting. The baby is having stepping reflex, and with that it is trying to push. Okay, so it is not, the baby is not feeling warm and it is not pushing. It is the baby like having its reflex, and that reflex is getting exhibited. Okay, so make the mother understand the baby must have adequate temperature, then only the baby will put on weight. Because whatever the food she is feeding the baby, breastfeeding, the baby is not going to take anything else, only breastfeeding, and that energy, first that energy will be utilized for temperature maintenance, then to the vital organs, then for the finally only it will come for like weight gaining. So if the baby, like whatever energy she is getting, so that energy, if it is being utilized to maintain the body temperature, then what will be left for weight gaining, nothing will be there. So always remember, in case if you want to put the baby weight also, like you have to maintain, that is like you cover the baby with a scarf, gloves and like socks and everything, you have to cover the baby. So when you get a question or warm chain, you have to remember these 10 points. So first you have to write the description, what is warm chain, hypothermia, hyperthermia, normal temperature, all these things you have to specify, and then you have to tell this 10 points of warm delivery room, immediate drying, skin to skin contact, that is your kangaroo mother care, KMC, and then breastfeeding, bathing and weighing the infant, appropriate clothing and bedding, mother and baby must be togetherly placed, and then warm transportation, warm resuscitation, training and awareness creating. Okay, so these are the 10 points you have to remember. Hope you understood the class. So let's meet in the next class. Till then, take care. Bye.